Our first panelist is Dr. Jeffrey Butts, the director of the Research and Evaluation Center at John Jay College of Criminal Justice at the City University of New York. He will tell us about ways to build safety with community resources. Dr. Butts.
Thank you, Charles. I very much agree with something Rebecca said, which is other strategies should never be described as alternatives or replacements for policing. When people say that, I think what that does is undermine the political support for these other strategies. And obviously we need other strategies than just policing. What I call this is building community safety with community resources, meaning there are things in a neighborhood we can do to improve safety. Sometimes people characterize public safety as being entirely a function of policing. If that were true, we would see it. When you go into a neighborhood and you can tell it's a safe neighborhood, you would see police everywhere if policing was the only way we produce safety. But obviously that's not true, that safety is a function of things in the community, the characteristics of the community, the resources in that community. But the challenge is, how do we turn that into a structure and a public policy framework that citizens can believe in, vote for, and support? What law enforcement has is a long tradition of identifiable interventions. People see patrol cars and uniforms and badges, and we know what they're doing, we know what they're for, and a lot of the public immediately trusts that that is to make them safe. You talk about other strategies and it's a little more amorphous, and it's harder for the public to hold on to. During the first few months of the pandemic, Arnold Ventures here in New York contacted John Jay College and asked us to put together a report. They also only gave us 90 days to do that. So our first strategy was to assemble the people on your screen to help create this report. Our challenge was to review empirical literature, meaning research studies that are of the kind of quality you need to rely upon with good statistical effects, just to find out things that would be associated with public safety. You'll see on the screen, we drew from people all over the country in universities, and each of them was asked to review and summarize just one piece of the puzzle. And they were nice enough to include me as if I were qualified to be in this group. And over the course of 90 days, we put together all that work and produced a report. The report is on the John Jay College's Research and Evaluation Center's website. You can see there it's called Reducing Violence Without Police, a review of research evidence. They asked us to look for anything that could be associated with lower rates of crime and violence, but we had certain standards. We would not simply take a study that was what I would call pre-post. People often say, we opened up this program and shootings went down. Well, that doesn't prove that the program reduced the shootings. So you have to be a little more rigorous than that. We also only reviewed things that we thought were feasible and practical for a community, not pipe dreams and blue sky. And then all these things were put into this report. In the end, we identified 7 evidence-backed strategies that could be helpful in helping to keep a lid on violence. Evidence-backed is not the same thing as evidence-based. Evidence-based is a phrase researchers use to mean something very specific about the level of evidence for an intervention or a program or a policy. These are evidence-backed in that there are credible findings from studies showing that there's an association between something and rates of violence. So let me go through those. We found 7 strategies. The first one might seem sensible to some people. It's improve the physical environment. We know from good studies, both post hoc statistical controls and also actual interventions that are designed as a test, that if you just improve the way a neighborhood looks and feels, it will actually reduce violence. So a neighborhood with plenty of trees, with buildings that are well kept, with no abandoned buildings, with traffic which is well managed, and there's not a lot of congestion and horn honking and all that, can make the neighborhood feel safer, and in return, people actually behave better and violence goes down. The trick is to make these into programs that cities can understand and intervene with strategies and to be intentional about, not just take advantage of random variation, but actually do this. There's literature, there are sources in our report you can click on. It's a credible strategy to make neighborhoods safer. Of course, it involves funding, and cities have to confront that too. But some things are very cheap. The next one is strengthen anti-violence social norms and peer relationships. This is what NOLA for Life did, basically. They took a model which is sometimes called the public health model. It acknowledges that violence spreads from person to person. People learn how to behave from observing other people behave. They find out what's accepted in their neighborhood. And programs like Cure Violence and Advance Peace have workers out in the community who are credible in that community, who form relationships with the people most at risk of being involved in violence, especially gun violence. And then you connect those people with resources. You talk to them about their lives, you make friends with them basically, and help turn them away from violence. That's not something you can just order up from some suburban social services agency. It has to be rooted in and grown from the community. When I started working on Cure Violence evaluations more than 5 years ago, and I can tell you the New Orleans effort was one of the most impressive I saw when we were touring the country talking to Cure Violence people. Not only was the program itself well conceived and being managed well, I noticed something I didn't see in a lot of cities, which was the law enforcement, city administration seemed to understand and value the program, and there was good coordination and trust, which is not always present in all cities. So congratulations to New Orleans. The next strategy is engage and support youth. And obviously anything you're doing in a city to try to reduce violence, you have to pay attention to young people. That's where most of the violence happens, unfortunately. By the time someone's 35, 40 years old, they're naturally starting to learn how to stay away from violent situations. But teenagers, 20 somethings, that should be the focus of an effort. And you don't have to always do therapy and what popular things like cognitive behavioral therapy. Sometimes just connecting young people to employment, to school, to reinforce in them the sense they have a future will reduce violence. And so that's a very important strategy. The next one also is obvious, substance abuse, but you don't always have to do professional drug therapy, drug treatment with people. Sometimes just having policies, closing alcohol distribution outlets that are accessible to teenagers, changing their hours, simple things that are described in the report can help reduce substance abuse and therefore reduce violence. And then a big one is financial stress. And this is something a lot of city officials are probably aware of, but they don't have any hope that they can ever change the situation, which is making the economic structure of our country less punishing for people to mitigate crises so that they don't, so you reduce the instances of evictions and so forth. That's something we're seeing a lot during the COVID-19 pandemic. Just helping people with their financial lives can help reduce violence. And then the last two are big, but you cannot ignore them. One is that we do have to have a justice system to intervene and to handle violence as it comes up. But if the community doesn't believe in it or perceives it to be a foreign body, you will not have the benefit of the justice process. You need to have a justice process which is transparent, fair, consistent. And that's a huge obstacle right now in this country, as we all know, but it's very important. And the last one is probably the number one task we have to confront, the gun problem. There's enough research showing, obviously, when there's a lot of guns flowing around the country, you're going to have shootings, gun violence. This country so far has refused to deal with it. Our elected officials just look the other way and pretend not to care. Someday we're going to have voters vote in people who take this seriously and try to do something about gun violence beyond just parroting Second Amendment rhetoric. And we're a long way from that. But if we don't do that, we'll just continue to have gun violence problems and continue to be talking about how to deal with it. Finally, all these strategies have to be evaluated. You can't just trust the fact that you have a great idea, let's go try to do it. You have to have partners that will do the measurements, track the implementation, track the outcomes, and produce evidence that your idea is actually helping to make a safer community. And that's tracking the outcomes. So you do need to track things like shootings, but changing the outcome is not sufficient. Just because shootings go down, as I said before, doesn't mean that the program or the policy reduce the shootings. You have to connect it. You need professional researchers as partners to help you demonstrate that. So what we call an effect size, statistical effect, which means, yes, shootings went down 20% in the program area. And importantly, they only went down 6% in a comparison area. If you have a well-matched comparison area, you can start to make the argument that your program actually reduced shootings. Finally, you need to go through this developmental pathway from an idea to the innovation to implement that idea, to do it multiple places or replicate it, to start to understand how it's done well, and to make it possible to do that well, what we call program fidelity, then evaluate it, and ultimately to do a rigorous randomized trial. Right now, community-based violence prevention is stuck probably in the first 3 stages of the idea, the innovation, and the replication. We do not yet have rigorous evidence that would convince a skeptic that these programs work. That report, as I mentioned, is on our website at johnjrec.nyc. That's my personal website, which connects to everything else. I appreciate the opportunity to speak to you today, and I'll now hand it back.
So thank you again for sharing your thoughts and insights to us. It's now time to shift to the audience Q&A portion of our program. Jeff, rigorous program evaluation is expensive and requires people with very particular skill sets. How can local governments and nonprofit organizations on tight budgets ensure that this important component isn't forgotten or conducted carelessly? And let me go to another one. Let's see, how can the impact of community-based strategies for safety be measured? Should organizations plan for measurement as they develop their programs?
Yes, when I saw these questions, I thought, are these friends of mine asking these questions? Because they're perfect. Yes, well, 2 things. Evaluation is less expensive if you build in regular creation and harvesting of administrative data. So if you're not dependent on collecting all new data every time, you can actually be producing a regular series of reports. The trick is to have administrative data that's something other than just law enforcement. If these programs are entirely dependent on tracking arrests and shootings and reported crimes, that's helpful and it should be a part of it, but it's not the full picture and misses a huge part of public safety if you're just looking at police data. But if you have things like jobs, evictions, school enrollments, dropouts, and you're tracking those on a regular basis, you can start to form some statistical relationships between your efforts and those outcomes. It takes time, but if you can educate your policymakers to be aware of all those different outcomes and not just focus on how many people were hurt by crime, you can actually start to demonstrate effectiveness. Then, yes, it should be part of your design early on. You should be thinking about it. So it doesn't have to be expensive, but you also need partners who are willing to work with you. One of my biggest complaints about my own community is academics too often only care about themselves. They want to get the best journals. They want to get promoted. They write things very wonderfully and send them off to journals that the community never sees. And that to me is not public service. It should be a value of local universities to have information that's circulated in the community, that's accessible to people, and that has an impact on public policy and decision making. But we have to reform academics in order to accomplish that. And that's another hurdle. It's tricky that even in my own university where I work, the most energetic, focused researchers are often early career researchers. And unfortunately, the university continually reinforces in them that the only way to advance is to publish in all those journals that only academics read. And I don't know how to get around that. By the time you're as old as I am with the white beard and everything, you can be more generous and focus on publications that are accessible to community. But I'm not the kind of person that should be out in the community as much. So what I do is hire young people to work with me to do the research, to do the data collection, and they're out in the community. And that's my solution to try to deal with this issue. But what you need in a local university is someone who is a post-tenure, someone who's already got job security, who cares about your mission, who wants to help develop information to evaluate your mission. And they're not just looking for your data set that they can go home and analyze and send off to a journal. And you have to get to know them. You also can't rely upon out-of-towners to come in and do evaluation because they blow half the budget on plane fare and hotels. You want someone that lives right there, that's from your local community, probably not your most prestigious university, but someone who is who grew up there and cares about the neighborhood and cares about your program. But they also have to be smart enough to know they need to develop good data and good analytics to can prove the case. You can't rely upon just rhetoric and political statements. What you need to do is anticipate the most egregious next mayor who's going to try to undermine your program. And you need to have data for that person who will come after you to try to back them up by saying, here's our evidence. And that's just, you have to have a long-term solution.